Europe's hospitals are seeing an alarming rise in cyber attacks, putting in danger patients' lives and their highly sensitive health data. One person's death in a UK hospital has been linked to a cyber incident, and the EU is now launching a €1.3 billion cybersecurity plan to tackle this issue. But will it be enough? Hello and welcome to Roundtable. I'm Enda Brady. Now, medical procedures cancelled, gridlock in emergency rooms, and disruption to vital patient care. This is the impact of the hundreds of cyber attacks on European hospitals every year. Why are cybercriminals targeting healthcare systems, and what can Europe do to protect them?
Cybercrime is often seen as a threat to privacy or money, but rising attacks on hospitals shows it can affect our healthcare too. In London, a ransomware attack in 2024 was linked to the death of a patient. Near Paris in 2022, hackers demanded $10 million after breaching a hospital's computer network. The French hospital did not pay up, nor did healthcare facilities in Ireland in 2021 that had similar attacks.
I think we're very clear we will not be paying any ransom or engaging in any of that sort of stuff, so we're very clear on that.
In 2023, there were 309 cyber incidents targeting the EU healthcare sector, more than any other critical industry. 54% were ransomware attacks, where hackers blocked access to computers and demanded a ransom to unlock the data. When systems go down, hospitals face huge financial losses. The EU Agency for Cybersecurity estimates each major incident costs around €300,000. The EU aims to invest €1.3 billion in healthcare cybersecurity. With cyber attacks rising each year, can the EU protect healthcare services and the millions of patients who depend on them?
Well, let's meet our guests. In the studio, we have Kelsey Farish. Kelsey is a lawyer who has worked with data protection at the NHS, that's the UK's health service. In Kalamata in Greece, we have Christos Xenakis. He's a professor at the Department of Digital Systems at the University of Piraeus. In Colorado, in the United States, we have Richard Staynings. Richard is Chief Security Strategist with the healthcare cybersecurity provider Cylera. And in London, Dr. Khaled Sadek. He is a medical doctor at the Arista Medical Clinic. You're all very welcome to this roundtable. Dr. Khaled, to you, I think a lot of people will be appalled to know that there are criminals out there who are prepared to hack into hospitals' computer systems and software for financial gain. Talk me through how you feel when you hear about these cyber attacks.
Well, it's very upsetting when you hear that patient information is being held to ransom for criminal enterprise. And so here in the NHS, what we want to make sure is our patients have the reassurance that their data is safe and that they can trust the services that they use, that when they speak to their doctors, it's entirely in confidence and that their data is protected. But obviously, when we have criminal gangs that are trying to disrupt the service, that are trying to use data to raise a ransom, or in the worst cases, that may ultimately lead in death because of critical infrastructure that's being disrupted. Very disheartening, and we're seeing a lot more of it.
Richard, to you, health data is highly valued nowadays. Is that part of the attraction for criminals?
I think it is, but I think we need to take a step further back and say, what does the security of healthcare information entail? And it really entails the protection of what we call the CIA triad: confidentiality, integrity, and availability. Our regulations across all jurisdictions essentially are myopically focused on the protection of privacy, whether it's GDPR or you name it, right? And that is really about protecting medical information from the public domain, information that should remain private and confidential. But confidentiality is just one of the tripartite legs here. Availability of health IT systems and data, as Dr. Khaled was talking about, is critical. If doctors don't have access to data, then they can't treat patients effectively. And if the data that they have access to is not integral, it's not valid, it's being changed, then that can obviously lead to a lot of concerns.
Christos, to you, increasingly, healthcare is becoming more and more digitized nowadays. And I guess this offers tremendous advantages in terms of speed of treatment and data that doctors can access for their patients. But it also presumably offers opportunities for these criminal cyber gangs.
Yes, as my colleagues previously said, when we have something which is digital, then this becomes a target of cyber attack. And I think also that the hospitals, in general, the health sector, in their priority, they have the treatments of the patient and not the cybersecurity of the system. So in this way, the hospital and in general the health sector is an easy target for the cyber attacks. Considering also the high value of the health data, this is certainly a high target for them and an opportunity to make money.
Thank you, Christos. Kelsey, to you, talk to me about the kind of damage cyber attacks can do to hospitals and healthcare institutions.
Well, one of the key things that they can do is they can just shake confidence and completely destabilize patient trust, but also doctors and other practitioners, they're going to lose trust in the organization that they're working with. And that's to say nothing of the physical or emotional trauma that someone is going to go through, knowing that, they're being delayed on a blood test, for example, or maybe they can't access a test result that they're waiting for. And then when you start thinking about the more serious incidents, it's things like missed appointments, technological failures. There's a lot of problems that can happen and not just physical ones.
I just find it morally, it astounds me that people are prepared to go after hospitals. So they clearly think there's a lot of money to be had here.
I think that that's because it's difficult to imagine any sort of data that's more important or indeed more sacred than your medical data. It speaks to your life and your death. It's your bones, it's your blood, it's the well-being of yourself and your loved ones. And so when people are thinking about what they can take to extract the most pain, the most money, then health data is going to be right on the top of that list.
Thanks, Kelsey. Khaled, to you, the National Health Service is under all kind of stress and strain. We see doctors working crazy, relentless shifts. How does it feel on a personal level when you hear of a hospital being disrupted by a cyber attack, patients missing out on appointments because of these criminals?
I think on a personal level, it really feels like a kick in the teeth when you've got staff that are working often beyond their contracted hours, going above and beyond to care for patients who are ill, who are dying, who are vulnerable. And then on top of that, you've got this currently have to swim against where criminals are trying to profiteer on most vulnerable people under our care. So it really is disheartening on a personal level.
Richard, you've worked in Europe and you're currently working in the United States. Do you see differences between how the other side of the Atlantic deal with these kind of situations?
Yeah, and I think there's a couple of things to draw here. One is the level of digital maturity between Europe, the UK, Ireland, and other health systems and the United States. And the other is really the private nature of healthcare delivery in the US, which is the dominant delivery mechanism. We're seeing a lot of targeting against US healthcare entities because of the digital infrastructure and the ease at which data can be extracted or held to ransom. And also the reliance upon digital services in order to render care to patients. we've done a number of tests in US hospitals around reverting to paper, and the US does terribly at this. I think in Europe, where there's more of a mixed system of paper and electronics, Europe survives downtimes a lot more effectively than the US does because of its reliance upon technology. And I think this is leading to a different approach. One is really around how ransoms are dealt with. And in the US, a lot of healthcare systems have medical breach insurance or healthcare breach insurance that they can rely upon in order to cover a ransom. In most European nations, healthcare is a function of government. It's either subsidized by government or paid for by government, and therefore under the control of government, where ransoms and extortion payments are frowned upon. So there's a different approach to paying ransoms between the two. And I think that leads to, perhaps some of the targeting we're seeing.
Christos, to you, now that we've mentioned the ransom word, what do you think of the situation hospitals often find themselves in? Should they be paying the ransom, or should they deal with it differently?
Yeah, I think this is a very important question. Personally, as a professor, I believe that we shouldn't pay. It's better to have alternative solution, for example, to have backup, to invest in security measures to prohibit, to defend the cyber attack than paying the ransom. This is a bad approach by paying the ransom, because in this way we give money to all this criminal circle, let's say, and we augment this situation by paying money and become more profitable. And there is also a possibility to pay the ransom and not get anything back. We have seen this in many cases. So let's say in Greece, I have participated in some cases. The Greek government decided not to pay any ransom, and they try to, through backups and contingency plan, to recover the system and get back to work the sooner.
Thanks, Christos. Kelsey, to you, it's an awful dilemma, isn't it, for leadership in hospitals, that your system has been compromised by these criminal gangs. They want money, and you've got to have that conversation. Do we pay the ransom or not?
It's a really difficult one. And I think that much like, if you're, let's say your child is being held ransom, I mean, you don't really know what you're going to want to do unless you're in that specific situation. It's one I really don't envy leadership in those positions at all. However, this is why we have the rules and regulations that we do, to offer some guidance. So obviously, if you criminalize or you prohibit a hospital from paying another criminal, like someone who's attacking you or holding your data ransom, then that's pretty straightforward. You can't do it because you're breaking the law. But then the next question becomes, well, okay, but what now? What do we do now? And, as a lawyer, I know very well that you could have the world's best contract with the most robust language and the best security measures ever. But if it doesn't hold up in practice, well, what can you do then? It's a really difficult one.
Isn't there the risk as well that you're dealing with criminals? You can't take their word. So you pay the money. Who's to say that they won't unblock your system?
Yeah, that's exactly right. And, it's one of those things too that, as a sustainable business model, it's questionable, right? But the better these criminals become, then hopefully the more robust and secure the hospital infrastructure will be. But it remains to be seen, because it's just this constant arms race, isn't it? And, the point was made earlier, the more digitized we become, we really risk lulling ourselves into a false sense of security. Oh, it's password protected, it's encrypted, two-factor authentication. But there's always going to be some brilliant criminal mastermind lurking around the corner. And that's what I'm concerned about.
Dr. Khaled, can I just get your opinion on paying ransoms? Should hospitals cooperate with these people, or just try a different approach?
Well, that's a difficult question. I think on a personal level, I'd probably say that we shouldn't be paying criminals ransom money. That seems to be a way of fueling their activity, encouraging them to do more attacks. I think there should be more robust cybersecurity measures that the NHS has to carry both on a national level and within local GP practices and hospitals. I think money is better spent reinforcing our cybersecurity. Money's already tight. I can't see why we would want to be funding criminals when we can funding patient care instead. So I definitely would say a no for that.
Richard, just on the point of cybersecurity, it's very expensive, but it's money well spent.
It is, but the costs of loss from resulting from a cyber attack are many factors, many orders of magnitude greater than the investment needed in order to secure a healthcare system in the first place. So it's a false economy to be paying ransoms to terrorists, which is what the FBI has termed cyber extortion operators. It's also illegal if the entity is a known terrorist organization to make those payments within the United States. There's a consultative document that's circulating the UK government right now about options to ban payments of ransom to cybercriminals. I believe there was also one last year in the European Council about a similar approach around the publication of ransom attempts in order to create better visibility and better tracking of these sorts of things. This is a difficult question, though, as my colleagues have said, and it really boils down to a lack of investment, a lack of prioritization of cybersecurity across healthcare, and a lack of resiliency built into the critical systems that are needed to keep patients alive.
Thanks, Richard. Christos, to you, just on that point, I mean, it seems the criminals are always several steps ahead of everything hospitals are trying to put in place to keep themselves safe. Is that a fair assessment?
Yes, I think yes, because the criminals are the first innovators, as I said to my students, because they earn a lot of money. They invest in innovation in order to be one or two steps ahead from the cybersecurity guys or from the critical infrastructure operators like hospitals. So what is necessary for the society is we need to invest in both directions, of course, in advanced cybersecurity measure, especially in the health sector, but also in training and awareness. I think that the most important part of the cybersecurity chain is the people, the person, the doctors, everybody, and we have to train and educate them in order to defend or to try to avoid to press a button, or when accidentally they do something wrong to refer on this and try to stop the cyber attack.
Thanks, Christos. Kelsey, a lot of the time these hackers will be scattered. They won't be in the same country. They may not even be on the same continent. Do you think we need to see more international cooperation between governments to fight them?
I think so. And harmonization is a big issue, especially in our increasingly borderless world, thanks to the internet. However, it's very difficult because different societies, different cultures, different countries, they have different ideas about, one, what to prioritize from a legislative perspective, and two, there are different ideas about what constitutes special category data or, very sensitive personal data. What's sensitive in one country might not be deemed super confidential or secretive in another. So you have to get a lot of people together and agree on things. But what I think people can universally agree on is that data concerning someone's health, well-being, their medical records, yes, of course, these should be treated similarly around the world. But what we end up doing with that, again, that remains to be seen.
Dr. Khaled, to you, how much responsibility do you feel as a doctor and your colleagues feel in the health service that you're pretty much the first line of defense against these cyber attacks, because their way into a system is via a spurious email to you, often with a link?
Well, look, I mean, most of medical care is now digitized. It's based on a computer. So we are very vulnerable, right, to attacks. There's lots of communication that's happening between different departments, different professionals all the time. And you want to be able to trust those communications that you receive, the emails that you get through NHS protected emails. We're able to trust the content of that. However, like you say, these criminals are very sophisticated. They appear to be one step ahead of the game, very innovative in the way that they're able to carry out these phishing attacks and make it look real. So I think, yeah, we are very vulnerable on the front line, where we're dealing with different bodies continuously every day, not necessarily those within the NHS. And so we are particularly vulnerable. But having said that, I think through education, awareness, and better sort of training and cybersecurity infrastructure, we should be able to fight this battle and be successful.
And just on the training you mentioned, you're getting it. You're getting what you need.
I think digital literacy is something that the nation as a whole can improve on. I think the pace of technology development is very fast. Every year, every 6 months, is a new digital product that we need to bring ourselves up to speed with, and I think that's really important. I think being able to provide up-to-date training that's relevant and across the entire workforce is really important. But like I said, the landscape changes almost every 6 months. There's a new product out there, so we really need to be stepping up our game.
Thank you. Richard, it's interesting. The UK Prime Minister Keir Starmer said the other day that he wants to really turbocharge the NHS app so that every person in the country, every patient, has a doctor in their pocket. That was the phrase he used. I'm guessing that will also present difficulties in terms of protecting data and stopping these cyber criminals getting into that app.
Exactly. It's going to expand the attack surface for the NHS. There's going to be more points of vulnerability that will need to be protected. But there are two fundamental problems here. One is that I don't think that the NHS has a good understanding right now of all of its points of vulnerability, the risks that are present across all of the devices that connect to the NHS network. And that comes down to a lack of visibility, a lack of understanding of what is connected. And the second is, back to the conversation before, which is talking really around security awareness. Humans are the weakest link, right? We do make mistakes. Doctors are under tremendous pressure with high patient lists, particularly on a Friday night in the emergency department, where they may be dealing with multiple road traffic accidents or other calamities that overstress everyone, and mistakes are made. We need to up our game in terms of security education, training, and awareness. And I think the current systems of sitting people down in front of a computer-based training program don't work. We need to look at a human vulnerability management solution that uses touches, that uses short reminders, that allows individuals to grow as the threat surface changes, and to have tools behind them that facilitate that learning experience.
Thanks, Richard. Christos, I just want you to come in on that point Richard made, that humans are the weakest link. You're dealing with doctors and nurses who are absolutely exhausted, working 15, 16-hour shifts, and one false click of a link on a computer can cripple the system. That really is the heart of the problem here, isn't it?
Yes, I think in this particular sector, in the health sector, this is the main problem. That's why the criminal focus on the health sector. This is one reason why they focus on the health sector, because they can not easily, but with a high percentage, they can break, let's say, the security of the personnel that is involved in the health sector, and achieve their goals. I'm worried about the future, because in the next year, we will see AI, generative AI, AI-based attacks that will enhance further the threats that the health sector will face in the future. So based on this, I believe that it's the right time now to invest in both in training and awareness, and of course to the advanced cybersecurity solution, because we cannot be the system cannot be based on the professional, on the doctors and nurses, because they are in pressure, they are very tired when they are doing their job. So we have to protect them And in case they do something wrong, they press a button, the system will protect them. Because this is why we develop advanced cybersecurity solution.
Thanks, Christos. Kelsey, final point to you. Politicians are always under pressure to put money into the health service, whatever country in Europe. This is something that they really need to start putting money into.
I would definitely agree. The issue that we have is that return on investment, right? If you invest in something like artificial intelligence or some other form of manufacturing, it's very clear that you're going to get a particular reward out of it, a particular benefit. The benefit in this case is, well, the data don't get stolen. And so it's really difficult to kind of quantify that. It's easy to stand on a podium and say, we need to protect patient data, but my fear, again, is just that those cyber criminals are going to be one step ahead. And unfortunately, politicians are not always technology experts, and they don't always know exactly what rules, regulations, or indeed practical tools are needed.
And your take on what Christos just said about AI, if these criminals start harnessing AI to accelerate their attacks, this could be very dangerous.
I completely agree. And that's my area of specialties, actually. So I would say, it's going to get a lot worse before it gets any better.
Thank you, Kelsey. Dr. Khaled as well, Richard in Colorado in the United States, and Christos in Kalamata in Greece. Thank you all so much. Remember, you can see more discussion and debate on our YouTube channel. Just search for Roundtable, TRT World. But for now, from me, Enda Brady, and all the team here, goodbye, and thank you for watching.